Hi, Sam here with 7E Wellness, and today I'm going to be taking you through a full protocol with the MyoLift Triwave, which I have right here. So I'm going to bring that a little closer for you. You can see the Triwave. It's our beautiful device, has this green trim on it. As you can see as well, it has the backlit screen, so you won't be able to read what's on the screen, but I'll tell you, of course, what settings I'm using. I have my classic probes attached to the device, so I got those right here. And I have my Replenish Conductivity Spritzer. I have my Renew Conductive Gel. Both of those do come with the Triwaves. You should have those on hand. As a little extra credit, I also have my anti-aging peptide serum. So if you have this, or even if you have another hydrating serum, you can grab that as well. You will want to begin on clean, dry skin. So my skin has been cleaned already, and let's jump in. So first I'm going to do a little bit of skin prep with my products. I'm going to grab my Replenish Spritzer first, and I'm going to apply that generously on the skin. So that's going to be our baseline of hydration. That is also going to infuse some electrolytes into the skin. So that has zinc as well as hyaluronic acid and glycerin to really plump up the skin and to help conduct that electricity. So for extra credit, you can take your anti-aging peptide serum, dispense 2 or 3 pumps of that into the hand, and then you can press that into the skin. So make sure you get the neck, and you can bring that right under the eyes and across the lips. Now I'll take the last bit of that and just put it right on the backs of my hands. Peptides are a beautiful ingredient to incorporate with microcurrent. Peptides are basically short chain little proteins that go into the skin, and they tell the skin to make new collagen. In this case, it's a copper peptide that we're using, as well as polypeptides. So now I'm going to take my Renew Conductive Gel, and I'm going to take a fan brush. This one is silicone, so it's nice and easy to clean. And I'm going to dispense that. So I like to take 1 to 2 quarter-sized amounts of the gel. So that's going to look pretty much like this. You can choose to apply it all over in the beginning, or you can put it on the back of your hand or on a dish, and then you can just reapply as needed. So I'm going to start out by taking a little bit of that gel and smoothing it on to my neck and that entire side of my face. So the Renew Conductive Gel, this one is beautiful for sensitive skin. This has our calming bioactive complex. So this has lavender, chamomile, and geranium, all 3 of which are beautiful botanicals that help to heal and calm the skin, as well as protect it from environmental stress. So I've smoothed that all over one side of my face. If the gel dries up while you're working, you can always come back in and you can use the Replenish Spritzer just to reactivate it. I'm going to grab my 2 probes, and first we're going to be using the Rejuve waveform. So this one is for lymphatic drainage. We always do this one first, then we follow it with Erase, and then we follow that with Educate. So I'm going to start out with Rejuve. You can do Rejuve on level 1. You don't have to feel anything. This can be nice and gentle on the skin. If it's comfortable for you, for example, if you feel no sensation, you can try increasing it to level 2 if you prefer. If you find that it's tingly or it's stingy or uncomfortable for you, then you may want to turn it down if you're starting to get any little zaps from the current. So I have Rejuve turned on my Triwave. I'm going to put her right back here. And we will begin our movements to do lymphatic drainage on this side of the face. So when we're doing lymphatic drainage, we have two probes. One is your catcher, and then the other probe is the one that is pushing and moving the lymph. So we're going to start down at the base of the neck. The catcher is near the clavicle here at the bottom of the neck. And now your moving probe is swiping delicately downwards towards it. And just a reminder, make sure that you press run and that your treatment has started and current is flowing. If you forget to press run, you might jump in and not realize that the device is still turned off. So when we do lymphatic drainage, we are helping to move something called lymph that is in the body. Lymph is an extension of your immune system. Lymph is used to move toxins around and ultimately dispose of them in the body. So for us to help that lymph move, it's going to help to detoxify and improve the health of the skin. So you see we started by unblocking the neck. This downward movement, you want to repeat at least 5 passes of that. You can do more if you like. So now I'm going to move my stationary probe up so that it's right under the ear and under the jawline still. And you can go and clear across the neck. So this is really good if you retain puffiness or if you have any issues with that along the jawline. If this is an area of concern, like I said, you can do more than 5 passes. You can really camp out here if this is a problem area for you. Okay, beautiful. So now we're just going to walk our way up the face. So now I have moved my stationary probe up. It's above my jawline, pretty much in line in front of my earlobe. And we're going to be draining now across the jawline. And we're going to work our way up the face. So not only are you helping to move the lymph that is just under the skin here, you are, with microcurrent, increasing the permeability of the cells. So now you're just going to move up a little higher. Now I'm starting at the corner of the mouth and going across. In making the cells more permeable, you make them better at absorbing nutrients. You also make them better at disposing of waste. So even if you compare this to a lymphatic drainage that you might do with just your fingertips, a manual, this is going to be doing a little bit more because of that microcurrent. So now I'm going to move my probe upwards. So now we're pretty much in line with the top of the ear, right in the hollow of the cheekbone. And we're going to keep working our way across the face. And I'm doing 5 passes, and then I'm just taking 1 step higher. So you can see I'm starting right next to the nostril now, and I'm going across along the cheekbone. And this is a very light pressure the whole time. So now you can take your probe and you can also go up a little higher now so that you're sitting on the temple, and you can clear directly under the eye. So if you're really puffy under your eyes, if you have a lot of fluid retention, or darkness can come from that sometimes if you have the appearance of a very dark or discolored under eye. This can help as long as that darkness is due to that fluid retention. So you can go under the eye, and then you can go right up through the eyebrow, and you can drain in there as well. Beautiful. So now we'll take another step up so that we're on the side of the forehead, and we'll drain across. Now you can see my forehead is a little bit wider, so I can do passes in a couple of spots here. First, I'm doing right above my eyebrow, and then I can even do a second pass above that, closer to my hairline. You may not have the space to do that, in which case you can just do one pass. Okay, beautiful. So if you think about it, we have basically moved all of the lymph over into the side area of the face. Everything has started in the center and moved outwards. Now we're going to come back once more and we're going to clear out this channel, and we're going to finish by unblocking the neck a second time. So what I like to do now is I will place one probe at the base of the neck where we started, and then my moving probe is actually going to start all the way up here, and it's going to drain all the way down the side of the face. So this is now just helping to clear out that lymph with a little more finality now that you've pushed it to the edge of the face. Now, if you find when the probes are this far apart that you're having trouble with conductivity, you could try adding a little more gel, or you could try misting the skin. You may just need a little more moisture in order to get that to work. So once I've cleared with this nice long movement along the side of the face, I will then just finish by doing that short movement that we started with, and just finishing by unblocking that neck one last time. So when it comes to lymphatic drainage, your face or your head is like the flower, which means that your neck is the stem. The only way that you can clear that lymph out of the face is by keeping that channel of the neck nice and open so that everything can pass. Okay, beautiful. So we've done one side of the face, and now we're going to come in and we'll do the other side. So now I'm going to grab my brush again, and I'm going to apply the remainder of my gel on the other side of the face. Okay, beautiful. So I'm going to go through this side a little bit faster since we explained everything with the first side. I'm going to start by unblocking the neck. Now I'm going to go under the jaw. Now I'm going to move upwards and work on top of the jaw. And I'm just going to keep walking my way up the face. So now we're on that lower part of the face, and we're beginning at the corner of the mouth. Now I'm going to jump up in front of the ear, and we're going to clear out where the cheeks are. Now we'll go to the temple and we'll work around the eye. Now up to the eyebrow. Now if you're somebody who also has very sensitive or very red or inflamed skin, lymphatic drainage could be a really helpful thing for you to try out. Just because it can generally help with inflammation of the skin. Now we'll make our way up to the forehead. Lymphatic drainage can also be helpful if you find that you're prone to breakouts. Sometimes that stagnancy and the buildup of toxins in the cells can contribute to acne and breakouts. So I'm just finishing up now, clearing the forehead. And now we're going to flush all the way down the neck. And then I will do a few movements just down here on the neck to finish up. Okay, perfect. So that was our lymphatic drainage, and now we're going to switch over to erase. So now I'm going to grab my device and I'm going to change it over to erase. I like to do erase on level 2. If you find that it's stingy or prickly for you, then of course you'll want to turn it to a lower intensity. So with erase, we're going to be starting up on the forehead. We're going to work on the frontalis here. And we're going to start with the probes together, and we're going to slide them apart slowly. So this movement is meant to smooth out the frontalis. This muscle is like a sheet of paper that covers the entire forehead. As we emote and we live our lives, this muscle tends to get bunched up and it gets tight, and that's why we see those wrinkles form on the forehead, because they are literal folds in the muscle. So you can see from this movement, we're using our microcurrent on our erase waveform, and we're just smoothing that back out. So I'm doing 5 passes of separating the probes, and then I'm moving to my next spot. So I did center of the forehead, moved over, and then moved over again. Now we're going to do this side. If this is an area of concern for you and you have deeper forehead lines, or you're just worried about them forming, you can spend more time here. You can do up to 10 passes for each of these spots that you want to work on. Okay, beautiful. So now you can take this a little lower between the eyebrows, and you can separate them here. This is going to be really helpful if you get that horizontal bunny line here, just to open that back up. And then you can turn the probe sideways, and you can separate this way for anybody that has 11s or who has frown lines up here. Okay, beautiful. Let me do one extra. So now we're going to work around the eyes. Here you will want to double check your intensity. You should be at or below 300 here. If you find that your eyelids are fluttering or you see twitching, then you'll want to turn it even lower than that. So I'm going to start in the outer corner of the eye, and I'm going to separate while following that curvature of the eye. So it's like a half moon shape that I'm making to open up and just smooth out any of those crow's feet or wrinkles. You can also work a little further out on the temple here. And we'll go to the other side. So we're starting close to the side of the eye, and we're hugging that contour. So this is the orbicularis oculi muscle. It's a circular muscle that surrounds the eye, and that's why we're really following the shape. And then we're going a step back here, because for some people that wrinkle formation does reach pretty far back, so we want to also relax the temples over here. Okay, great. So I'm actually going to take... If you heard that beeping, it's because the timer on the device ran out on me. So I'm just going to increase my time again and apply a little bit of mist. Now I'm going to be using the probes on the upper lip. So this is really helpful for lip lines. They're starting together and then they're separating. And you're just going to the corners of the mouth here. Now we're working on the orbicularis oris. It's another circular muscle, and this one surrounds the mouth. So we're smoothing it out in order to help prevent the formation or treat any lip lines. Those little vertical lines that exist along the lip line. So now we'll do the same thing for the lower lip. Now, if this is really an area of concern for you, you can also plant the probe. You can go to an area of concern and you can kind of iron it out like this. If it's not an area of concern for you, then perhaps you won't need to worry as much. So I'll just do a little bit here, and now we'll move down to the chin. So I'm going to plant the probe right under my lower lip, and then my second probe is going to draw downwards from there. So this helps to release some of the depressor muscles that pull down on the mouth. This also helps to unfold the chin. Sometimes people get what's called a mental crease, where the chin folds up and it starts to touch that lower lip. So we've done that movement in the center. Now we're going to move to the side of the mouth and we'll do the same thing. Now we're still staying within the bounds of the mouth. You can see I'm stopping where the corner of the mouth is. And then we will do the other side. And you'll see I just switched which probe is stationary and which probe is moving. That's totally fine. You can switch back and forth between the probes. As long as they are both touching the skin, then you're getting the benefits of the treatment. Okay, so we worked on the chin as well, and that concludes our movements for erase. Erase can be pretty quick as long as you're not treating any areas of concern. Even so, you should be able to get through that within, say, about 10 minutes. So next we're going to be moving on to educate. So we're going to change over to our educate waveform. So I'm just going to take a little bit more of my replenish spritzer. My skin is a little dehydrated, so the gel is kind of drying down quickly on me. You may find that that's not happening as often for you. It just means your skin is more hydrated than mine is. Okay, beautiful. So we have our device, we have it on our erase waveform. I like to work on erase level 2, but again, always defer to your comfort. So if you find that it's prickly or you're seeing twitching visibly, then you'll want to turn it down. So we're going to start down on the neck, and our movement for educate is going to be a pinch and hold. So we're going to place one probe towards the side of the neck. It's still in front of the ear. And we're going to take our second probe and go towards it. And we're going to hold for 3 seconds. And we're going to repeat that 3 times. If you're treating an area of concern, you can repeat it up to 5 times. And you can hold it each time as long as 5 seconds. Perfect, so I'm doing my pinches on the neck. If you find that there's not a lot of tissue there for you and you don't have a lot to really pinch, that's okay as long as you're still doing the movement. So I'm going to just take one step upwards and I'm going to do the same thing. I'm still under the jawline, but I'm a little closer to it. So right now we're working on the platysma. The platysma is the muscle that covers the entire front of the neck, kind of like a turtleneck, and then it wraps around the jaw up here. So we've gone horizontally. Now we're going to place our probe just under the jawline, and we're going to go upwards towards it. Okay, beautiful. And if you have the space, then you can take one step over. As long as you're not in the center of the throat, you'll see I'm still avoiding this space in the middle where the thyroid is. If you have a smaller neck, you may not have enough room to do this second row, and that's okay. So now we're going to move up onto the jawline. So we're going to be grabbing right on top of the jawline, and then we're going to push it slightly upwards, and then we'll hold it there. So I'm starting out at the edge of the face, near the corner of the jaw. So when you're holding, you just want to make sure that you are in an elevated position, slightly above the jawline. And then we're going to move over. So now we're closer to the center of the face. Beautiful. So if you are concerned as well with the jowl area, we do want to avoid the thyroid, but you'll see we can place one probe on the jawline, and then you can kind of go right under the chin, and you can sort of cheat under the chin a little bit just to grab the platysma here and help bring it upwards. Now that being said, microcurrent is going to help to define the neck. It's going to help to reduce a double chin or a jowl area by strengthening the muscles and by improving the health of the skin. What it's not going to do is get rid of fat. So if you have, like I do, a little bit of fat here that gives you a double chin, microcurrent will improve the appearance of that, but it's not going to get rid of the fat that is there. So now we're going to move up, and we're basically going to grab the corner of the mouth and then push it slightly upwards. Okay, perfect. So we're working now on our levator labii muscle. This helps to lift the corner of the mouth and create that really nice youthful upturned smile effect. Beautiful. So now we're going to take one probe and we'll plant it on the upper lip. The second probe is going to start down on the jawline, and you're going to do a half moon shape up to meet it. So I'm going to do that again. We'll start down on the jawline, and you're doing a half moon shape going upwards. And one more time. Beautiful. So this is starting to work on, again, those corners of the mouth, but also lifting this apple of the cheek. So now we're going to place our probe a little bit higher. So now we are on the apple of the cheek, and we're going to do another one of those lifts here. great. So now we're going to plant again on the cheekbone, but we're just going to go straight up now. And we're a little further away from the mouth than we previously were. So all of these movements that we just did are also going to be really helpful if you're worried about nasolabial folds. So sometimes those are also called marionette lines, and they run right here. Now we're going to take a step over, and we're going to do the same thing. Beautiful. And if you have space like I do, you can take a third step and you can do it again. Okay. So we did some upward lifting, but now what we're going to do is we're going to lift outwards. So you're going to take your stationary probe, you're going to place it pretty much in front of the earlobe, and then you're going to take your second probe, you're going to start at the corner of the mouth, and you're going to go towards it. So now we're activating the risorius, which runs diagonally. Basically it runs like this, and it helps to pull up the face. So this is a really good area to focus if you're worried about that lower face. This can definitely help to tighten it up long term by strengthening that risorius muscle. Okay, great. So now I'm going to take my stationary probe and I'm going to go up onto the cheekbone. So pretty much in line with the ear here again. And I'm going to start again in the corner of the mouth and I'm going to go towards it. So now we're working on the zygomaticus major. It's another one of these stronger, larger facial muscles that runs diagonally here. Okay, perfect. So we're going to do one more. We're going to take another step. So now we're on top of the cheekbone, kind of in the temple here. We're going to start in the nasolabial fold. So a little bit higher up, and you're going to go towards the temple. So now this is the zygomaticus minor that we're working with. Can also bring this a little further forward so that you can get a little bit of a meatier pinch here. Beautiful. So those are all of the movements that we would do for this lower part of the face. What we're going to do now is we're going to start working around the eye. You'll probably want to be at 300 or below with your intensity. If you see, again, any twitching or anything, you'll want to turn it lower. So I'm going to take one probe and I'm going to put it under the eye in line with the tear duct. And then the other probe is just going to slide right in next to it. So right now we're using that educate waveform to stimulate the under eye area. It's stimulating blood flow, it's plumping, and it's smoothing the under eye. So this is really nice to get that rested appearance. It's also really nice to brighten the eye area, just give it a little more vitality. Beautiful. And now we can move up to our eyebrow. So we're going to work here on the corrugator muscle to really lift that brow. First, I'm going to start on the tail. I'm going to grab it and then just push it slightly upwards and hold. So this is going to be really helpful as well if you have very hooded eyes, if you feel like your eyebrows are uneven or they've become droopier over the years. This will help to pick them back up and create a little more space in that eye. So you've done 3 pinches here. Now we're going to move and do the center of the brow. So you'll see I'm just doing a little grab and lift movement, and I'm just ever so slightly elevating. So you're not stretching, you're not using a deep pressure here. You can still be quite gentle, quite delicate with the skin. Okay, so now we'll move to the head of the brow. So I will plant right under here and then do a little bit of a wiggle to help release that muscle as I'm pushing upwards. So you'll notice I will continue to do that wiggle whenever I'm near the head of the brow like that. That's just one of my tricks that helps to release that natural tension. Okay, beautiful. So now I'm going to take my probes sideways. We're going to start with them apart, and then they're going to slide together and lift. First over the head of the brow. Now we'll move and lift over the center of the brow. And now we will do it over the tail of the brow. So you can kind of bring that upwards into the temple a little bit to create that lifted appearance. This gives kind of that fox eye look to the eyebrow, where the tail is more lifted. Okay, beautiful. So the effects on me are pretty subtle. I'm not only somebody who's a little bit younger, but also somebody who does this all the time. So it's not a true before and after, but even so, I think you can see this eyebrow. It's a little bit elevated and released compared to this one. The eyebrow on this side is just slightly lower. And a couple of little differences. I think you can see some more definition in here. But now we're going to go over to the other side of the face. This should be a little bit quicker since we did a lot of our talking, and we'll finish up our treatment. So we're going to start on the neck again on our other side of the face. I'm going to plant my probe, and then I'm going to go horizontally and do my first pinch on this side. And then I'm going to take one step upwards. But still under the jawline. So now I'm going to plant under the jawline, and I'm going to go upwards to meet it. take one step over and do the same thing. Now we'll move to the jawline. I'm going to start towards the outer corner of the jaw. And then take a step inwards. And just like we did earlier, we can kind of cheat over and we can grab a little bit of that double chin area. Now we move up to the corner of the mouth. Now we plant on the upper lip and then do that half moon shape going upwards from the chin. Now while you're working around the mouth, you might detect a taste, a metallic taste. That is totally normal, so not a reason to have any concern. So we'll bring the probe up a little higher next to the nostril, and we'll do that again. And now we're going to work our way across the cheek. So I'm going to plant on the apple of the cheek and then just go straight up towards it. Now we'll move to the outer part of the face. Beautiful. So now we're going to work horizontally. So first we'll do the risorius. You're going to plant in front of the earlobe, start at the corner of the mouth, and then go outwards. Now we'll plant near the top of the ear. Start from the corner of the mouth and go diagonally. This is for the zygomaticus major. And now we'll plant a little higher towards the temple. Start in the nasolabial fold and go diagonally upwards to work on the zygomaticus minor. Beautiful. So now make sure your intensity is not over 300 because we're going to go under the eye. You're going to place under the tear duct and then you're going to slide in right next to it. And now we're going to go up and work on the corrugator. So we're going to grab the tail of the brow and then we're going to elevate. Now we're going to move to the center of the brow. And now we'll move to the head of the brow. And we'll do a little wiggle in here to release the tension. Beautiful. So now we're going to start on either side of the brow, slide together, and then lift at the head. Now we'll do the center of the brow. And now we'll do the tail of the brow. Kind of cheating up into the temple here. Beautiful. So now as you get to the end of your treatment, I always do a quick little check for symmetry. We as human beings are not symmetrical creatures, but you can always do a little bit extra on one side or another if you want to help get a little closer to that symmetry. So in my case, I'm actually going to do a little bit more right on the head of this brow. My brows naturally are a little bit uneven, and this one does just sit lower. So I just always like to do a little extra here. But otherwise, if you are done and ready to conclude your treatment, you just want to towel or rinse off any remaining gel on the skin. Afterwards, you can apply any of your preferred home care. Microcurrent is something that you can do with no downtime, so there should be no ill effects to the skin. I would do this for best results at least once a week. If you want to do it more often, you can do every other day. If you want more of an intensive approach, that is going to help you to get your results a little bit faster. But otherwise, I hope this helped. Thanks for tuning in. and I hope you enjoy your future skincare treatments.